SABC News international editor Sophie Mokoena joins us for more. So has there been any other reaction from around the world to this variant?
Well, of course, Nzinga, you are aware that when you talk about the United Kingdom, you are also partially talking about what's likely to happen in Europe, and we expect the European Union to take a final decision today. You are aware that as we speak, much as South Africa has indicated that they have detected this variant, it doesn't originate from South Africa, I must emphasize, because you have a similar problem in Botswana. The country and Department of Health and scientists are expected to have a discussion with the World Health Organization so that they can share information and also give facts in terms of the behavior of this variant. And therefore, more information will be given to countries and also different regions and more reactions. Perhaps we can expect later today some countries making announcement in terms of what's their action in ensuring that people coming from particularly the SADC region don't have this virus. But we know that the United States of America, for now, there hasn't been a word yet, but as they start business later today, we may hear from the United States of America and also your South America. We also expect a final word from Asia, but earlier on, we had information that there are challenges in Hong Kong, as it was reported by South Africa.
I see Ursula von Leyen from the EU saying the EU Commission will propose in close coordination with member states to activate the emergency brake to stop air travel from the Southern African region due to the variant of concern. So it really is looking like it's going to be a very different December from what we had initially anticipated. South Africa is not the only country, though. Botswana and Hong Kong have also reported the new variant. Any other countries?
No, at the moment we know that it is Botswana and South Africa, and we were able to get a report from Hong Kong in terms of what transpired there, and it looks like the Hong Kong case is linked to South Africa. Let's take a listen at what Richard Kimber had to say on this matter.
Life is largely getting back to normal here in Hong Kong. People still wearing face masks in public places and carrying bottles of hand sanitizer whenever they're out and about. But as you can see behind me, people going about their daily business as usual. Now that's because for many weeks now there's only been a handful of new COVID-19 cases in the city, and all of those have been classified as imported cases, meaning that they've been recorded on incoming travellers rather than as locally transmitted cases between locally based people. Now that's been the key driver behind the government's insistence here on keeping the territory's borders tightly controlled and on insisting on up to 3 weeks of mandatory hotel room quarantine isolation for all incoming travellers, even those who have been fully vaccinated. Now, one such fully vaccinated traveller who arrived into Hong Kong from South Africa has caused concern for health experts here because he's tested positive for a new variant of COVID-19, and just a few days later another guest in the same quarantine hotel also tested positive for the same variant. Now, health experts here say this new variant has almost twice as many spike proteins as the Delta variant that's been well documented now, making it potentially even more contagious and also potentially more resistant to vaccines. Now, as a precaution, 12 people from that same quarantine hotel have been moved to a government quarantine facility for closer monitoring, while the 2 people who tested positive recover in hospital. Now, over the next few weeks, the government is taking further steps to try and increase its measures to prevent a further outbreak. It's insisting that the public download and use a government contact tracing app for COVID-19 on their mobile phone. You must register now whenever you go into a restaurant or a gym or a cinema or other public places to show that you've been there and for how long, to make it easier for the government to track any potentially locally transmitted cases. From next week, there'll also be a new health code system introduced here, mirroring a system being used in mainland China that will give everybody in the city a level of perceived transmission risk in order to better facilitate the reopening of the border with the Chinese mainland. And the government is also continuing to pressure the public to get vaccinated. A third of the population here still have not been, and it's offering free booster shots for people in vulnerable groups in society who have already been inoculated. Now, over the course of the past year, there's been various levels of public opposition for the different government COVID-19 directives, but the authorities here hoping that the new concern over new variants and the public desire to travel again will both combine to make the public mood rather more in line with following the rules. Richard Kimber for SABC News in Hong Kong.